Hi, so this is my newborn assessment of little baby Jack. Jack's here. He's quiet and settled. We waited till he was about 3 hours old to do our newborn assessment. So he's nursed. He had his golden hour with his mom. And I'm going to read my notes so I don't miss anything. He was born actually on his due date, which only about 5% of babies are born on their due date, so that's kind of cool. So he's 40 weeks and 0 days gestation. His prenatal period was really uneventful. His mom started prenatal care at 11 weeks, and she had consistent appointments, did all the normal screenings, and her prenatal period was pretty much unremarkable. She was GBS negative, hepatitis B negative. She was immune to both varicella and rubella. All the rest of her screenings, the RPR, chlamydia, gonorrhea, all of those were negative. And she had a B positive blood type. And I guess the only thing, she declined Tdap during pregnancy. Her pregnancy was really healthy with no relevant issues. So we're going to start with the Ballard assessment, where we're going to look at both the neurological maturity and the physical maturity. So we'll just kind of start with posture. Baby's posture is normal. Flexed arms, flexed legs. It's kind of hard to see in a doll, but he flexes great. And that's pretty consistent with a Ballard score of 4. He's going to end up with a Ballard score of 40, which puts him at a gestation, actually a Ballard score of 44, which puts him at a gestational age of about 41 and 4 days, which is appropriate. The scale can tend to make the baby seem older than they are, but he's full term at 40 weeks, and we'll go through the rest of this assessment. So we did the square window, which is the wrist flex, and he had 0 degrees, which is appropriate for a term baby. For his arm recoil, we kind of held his arms down for a few seconds, held him down, and then let him come down to arms, and then they immediately bounced up and recoiled, which is appropriate for a term baby. Popliteal angle. So we pulled his knee up to his chest, and we got about a 90-degree angle, which is appropriate and gives him the score of 4. The scarf sign, we kind of pulled his from shoulder, arm all the way over, and his elbow is exactly midline, which is what we expect, and it shows us that he's got good muscle tone up here in his shoulders. Heel to ear. Now we're going to take this heel and try to bring it as far up as we can with his ear, and there's some resistance. The foot doesn't quite reach the ear, and so that gives him a score of a 4. Okay, so now we're going to go on to the physical signs. As far as his skins go, he's pink. He's not really peely, so he's not overdue. He does have some vernix in the creases, but overall he's just pink and kind of smooth skinned. Gives him a score of 4. As far as Lanugo, he really has maybe a tiny bit of hair like on the back of his shoulder, but there's really not much at all, appropriate for a term. Plantar surfaces, when we look at the crease lines on his feet, they have creases across the entire surface on both feet. As far as nipple buds, he's got about 4 millimeters raised nipple buds. Gives him a score of a 4. His ears are firm and well coiled. They bounce right back. And I think that's the end of the Ballard score. So he scored 4 on each of those, actually, which is a score of 40. The other thing that I didn't tell you is that his testicles, the testicles have descended, and he has some rugae on his scrotum. So that gave him a score of a 4 also. So total score of 44 gives him a gestational age of 41 and 4 days, a little bit over his actual gestational age, but still within the window of normal. So as far as this physical exam goes, we're going to start with his head and just kind of feel the suture lines. There's no overlapping sutures. There's no caput or cephallohematomas. I'm looking at his anterior fontanelle, and it's about 2 finger breadths across, and we kind of feel all the way down, feel back. It's soft, it's flat. His posterior fontanelles are closed, and they feel good. As far as his head goes, it's well-rounded, it's symmetrical, and feels good. So then we're going to come around and kind of look at his eyes, and I'm going to get my otoscope, my light here, and we're going to kind of look for a red reflex. Oh, there it is. Other eye, there it is. That tells us that he doesn't have, that his retinas are attached, and that he has no, I lost the word, sorry, it's the scales that go over our eyes that old people get. Sorry, I just lost the word. So his eyes, when we look at his eye lines, they're appropriately spaced. We follow that line up to his ears, and his ears are appropriately placed as well. When we look at the ears, there's the pinna, there's no skin tags, there's a good opening, they are symmetrical and even. And we're going to go down to his neck and kind of feel collarbone and clavicles. And I'm trying to get where you can see me. So the clavicles feel, there's no crepitus, they feel even, they go all the way out, and bilaterally they're the same, and he has good movement. Neck, he has good movement and good flexion, good range of motion. I'm going to go ahead and look at his nose now. We want to make sure that his nares are open, that his nose is midline, and that looks good. I'm going to go into his mouth. He's got a good suck reflex and a good, when I go back a little bit farther, we can get a good gag reflex on there. Additionally, I'm not seeing any extra teeth or pearls or anything. He's got his soft and hard palate are intact. He does have a tongue tie though, and so it's pretty significant. That frenulum is pretty tight. We're going to make a referral for that because that could cause speech issues down the road and feeding issues now. So then we're going to kind of go down, and while we're here, I'm just going to, oh, where'd my stethoscope go? We're going to listen to his heart for a full minute, and I'm going to listen in a couple different places. I'm going to listen to the left of his, to the right of his sternum and to the left. We're going to go down here to herbs, down here, kind of paying attention to the size of the heart and where it's placed. So I'm going to listen for a full minute. His heart rate is 145 beats per minute. And I'm going to go ahead and just take a time to listen to his lungs. I'm going to listen here on the side because you can, okay. Listen again. Yeah, he's nice and clear. And I listened for a full minute, and his breath rate, his respirations rates are 42. 42 for a minute. He's nice and clear. He was pretty wet when he first came out, but 3 hours later after he's nursed, he sounds nice and his lung sounds are normal. I'm going to kind of listen a little bit on his back. Yeah, he sounds great. So now we're going to go ahead and move to his abdomen, and first I'm going to listen. He has great bowel sounds, and now we're going to palpate just to make sure we don't feel any masses or tumors or anything that shouldn't be in there. Okay, and so I can't really palpate his spleen, but I can feel the edge of his liver over here underneath his right side of his ribs. His bladder is not, I'm losing my words, I'm very sorry, but his bladder is not distended. And kidneys, I did see that if we press down here, we should be able to palpate them. They feel normal in this little baby doll. So let's go down, and his movements are all good. They're even and symmetrical on every side. He's got good strength and tone. And we're going to go ahead and look at his hips now. And so I'm going to kind of grab onto his femur, back to his hip, and we're going to push in, and then we're going to come around, and there's no click. So we're not worried about him having any kind of hip click or hip problems according to our assessment right now. We've already looked at his testicles. They have descended. His penis is straight. His urethra is midline. We haven't seen him pee yet, so we don't know if it's going to be a straight stream, but we'll be looking for that. And then we're going to kind of turn him over on his back, and we're just going to look. He's got a nice straight spine, no dimples, no hair tufts. I don't see any kind of Mongolian spots or other markings, birthmarks on him at all. Just to touch on that for a bit. And now we're going to kind of look at a few reflexes. With the Maro, we're just going to kind of pull him up a little bit, drop him down, and did you see that? He just startled. It was a perfect Maro reflex. So after that, we did the sucking reflex, we did the rooting reflex, and he just kind of turned his head over and then kind of wanted to suck on my finger, because that shows us he knows what that means when he gets that little cheek stroked. He wants to eat. And we're going to do the palmar grasp. Oh, I put my thumb in there, it just grabbed me. I'm going to do it here with the plantar. Oh, look, he just grabbed around my finger. And now I'm going to do Babinski. Oh, there you go, fanned out perfectly. Those toes fanned out so good. And I didn't tell you this, but he has 10 fingers and 10 toes. They are perfect, no webbing. When I look at his hands, he has normal creases, 2 creases across both of his hands. And we're going to do a little walking reflex. Beep, beep, beep. See that how it just happens for the first little bit of life. He can do first day or two. He'll do little steps for us. He does it perfect. In fact, I think he'll be walking very soon. So I just want to make sure I'm not missing anything. When I listen to his heart, I don't hear there's no detectable murmurs. Of course, when he leaves at 24 hours, we'll run the congenital heart defect screening and check his O2 sats on his hands and foot to make sure that hole has closed, his ductus arteriosus. And so as far as a plan for him, I want to make sure I'm covering everything. So let me just make sure. I've talked about his alertness. He cries. He's appropriately consoled. He has periods of awakeness and alertness, and then followed by sleep or just quiet. Just making sure I'm not missing anything. Okay, and I think, hopefully, I covered everything. I feel like I did. So let's talk about a plan for him. The assessment that we have for him is that he's a 40-week gestational male. He's 3 hours old, and he's already had his first time of latching on, breastfeeding. He had a good solid 45 minutes back and forth with his mama. So the second diagnosis is that he's a breastfeeding baby. And the third one is that he has ankylogogia. I know I'm saying it wrong, because we never say it. We always say tongue tie. So I will look that word up so that I can pronounce it correctly. I have pronounced it correctly before. So he's got the tongue tie, and our plan is that we'll discharge him home with mom as soon as they're both stable, and that will be, for us here at the birth center, it's really it's less than 12 hours. It's about 4 to 6 hours after birth, and that's when we'll send them home, so long as everything remains good and stable. And by the way, it's very warm in here. We keep a little warmer on here, so even though I didn't address the warmth, he's very warm. And we are making a referral to a pediatrician who does laser clippings of the tongue tie, so that will happen in the next next day or so that breastfeeding won't be an issue. And the last thing, we'll be doing some breastfeeding education with the mom that's going to focus on latching and positioning, transition from colostrum to regular milk, so that she kind of knows what to expect. We'll also talk about breastfeeding milk poop and the transition colors from that initial meconium to the green to the bright yellow orange that we really would like to see this baby have. So additionally, I just want to say we've already weighed and measured the baby. The baby has a 33 centimeter head, a 35 centimeter chest, and the baby weighed 7 pounds, 12 ounces, and had a length of 19 and a half inches. So I'm thinking I covered everything, and I hope you will have the wonderful chance of meeting our dear baby Jack very soon.